Well, good evening to everyone. Thank you so much for joining the second district of Omega Psi Phi Fraternity Incorporated, our monthly COVID-19 webinar update. Listen, those of you that have been with us for over a year now, we just want to thank you. Thank you for coming to get this information. And we certainly want to thank our doctors, our presenters that will be talking to us on this evening. What we're going to do is, as always, we always want to thank our sponsors. So certainly, we'll be mentioning the American Red Cross a little bit later in the program. But most importantly, our doctors that take the time to share this information and our other government officials. So for those that are joining us for the first time, certainly want to welcome you. Shout out to all of our brothers and sisters of the Divine Nine that are joining us this evening. Let me quickly introduce to you this esteemed and distinguished panel that will be joining us tonight. We're going to start off with Dr. Boykin. He is a retired pediatrician, and he always brings us the latest and greatest as it relates to our children, and so imperative as we continue to deal with this. Dr. Boykin, good evening. Good to see you. Also going to introduce to you that's going to be with us tonight, our doctor, Jedan Phillips. Dr. Phillips out of New York was at the heartbeat. He was at the epicenter when this all began and certainly continues to bring us updates. Dr. Phillips, good evening to you, my good friend. Also want to introduce one of our good brothers. He is a vice boss, as we call it, a vice president of our chapter, but he also works for the government. Dr. Guyton, good evening to you, Brother Guyton, and we are just looking forward to one other horseman joining us tonight. As always, our disclaimer, although the brothers are bringing valuable information, these are their words and their words only. They do not represent the interests of Omega Psi Phi Fraternity Incorporated or the businesses that they're employed with. So with that being said, Dr. Boykin, let's start off with you. Good evening, and talk to us, Dr. Boykin. What do you have for us this evening? So, Dr. Boykin, we're not here. I don't know if you're on mute. I'm going to try one more time. Yeah, I'm not hearing you, Dr. Boykin. I tell you what. So I'm gonna let you work that out, Dr. Phillips. The
Hey,
epicenter.
good evening.
Go ahead and get started.
I think that, we've gotten away from COVID because we were sort of made a little drunk by the success that we've had over the past few months with the vaccination rates going up, with us being able to experience some new freedoms that we have not had in some time. However, since the 4th of July, thereabouts, the numbers have steadily been going up. And unfortunately, right now, the Delta variant, which is what everybody's talking about, is the hot item when we talk about the COVID variants that are out here. The Delta variant is the new prominent strain. They say over 80% of the new cases that we are seeing now are related to the Delta variant. And with respect to that, unfortunately, the other thing that we're seeing is that in comparison to COVID that we were initially confronted with last year, now this Delta variant is twice as infectious. So that means that, again, we've learned how to be safe, but even with those safety measures, wearing a mask, etc., this virus can still penetrate. And unfortunately, it is lurking and menacing in areas where we see that there are low rates of vaccination. So as I said in my first part of my remarks, I think we are at a critical juncture because we have the tools, we have the information. However, the biggest thing that we're dealing with right now, it appears to me, is misinformation. I get asked questions all the time about COVID and the vaccine. And it's amazing, even after a year and some change, even coming from people that have graduate level degrees, that there is still a high degree of misinformation, y'all. So what do we need to do as men of Omega Psi Phi and other members of the Divine Nine? we've got to do what we've been challenged to do, which is be leaders, which is mean we've got to get involved with conversations that address this misinformation. If I'm an individual that is searching and reading stuff, because what happens is that a person can see a highlight or a byline on Facebook or some type of social media presence, and they do not read all of it, and then they just spread it. And that's how a lot of this misinformation is happening. Of course, I think there is also an intentional component of the misinformation, but I think this misinformation is affecting us in a major way because we have not reached that mark of herd immunity that we have once been talking about. And unfortunately, because we have not reached that mark, the virus is still here. Now, the other interesting thing at this critical juncture is the country is not trying to stop and shut down like it did last year. So businesses, other entities are hoping and expecting for their workers to educate themselves about the vaccine and make an educated and informed decision. And for those that do not take advantage of that opportunity, informing yourself, if you choose getting a vaccine and they don't do anything, there's a potential that you could lose your job. And there are a lot of different entities now that are now holding people accountable for, I'm going to wait and see. The other thing, as we enter the new school year, we may see yet again another disturbance of the educational process of our young people because they may not be vaccinated. Now, we still have an under 12-year-old category or group that does not have a vaccine available for it. And the way that we are able to protect them is by decreasing the amount of virus in the environment. And one of the big ways that we can do that is by getting vaccinated. So with that, I'll yield my time back so we can get into this very important conversation.
Certainly. It definitely is a lot to talk about on tonight. Thank you so much, Dr. Phillips. Dr. Boykin, let's do a comms check with Dr. Boykin.
Can you hear me now?
Oh, yes, sir. We sure can. Go ahead, Dr. Boykin. Get us started.
All right. Well, this is a first for me. I welcome everybody tonight. This is a first for me following 88. He usually follows me. He has a lot of information that I wanted to talk about. But there are at least 5 important areas we need to talk about. And Dr. Phillips has certainly hit on a bunch of those. And we need to seriously discuss vaccine misinformation, the Delta variant, the resurgence and the mitigation that we need to do again, and the requirements for vaccination by employment and return to school for fall 21 and the unvaccinatable children, as I call them. So the first thing is Dr. Phillips talked about is vaccine misinformation. This is probably the largest factor in decline in vaccination and hesitancy that we have out there. You know, the early release things, when we first talked about COVID-19 years ago, some of these misinformation facts are starting to rear their ugly head again. People that never took the time to read the information in the beginning and just listen to this stuff on the social media is now putting this stuff back out there like it's never been out there before. And people are foolishly believing this misinformation things. And this is running rampant on social media. So we need to get a control of that and put out the correct information. And this leads to a pockets of largely unvaccinated people that are just perpetuating these misinformation. So, you know, the AAP statement on vaccination is strong support of vaccinating children and adolescents. So we really need to consider doing that. So, you know, as Dr. Phillips said, this Delta variant is a big deal. It's 83% of all the new cases in COVID-19 in the United States. And also worldwide, globally, this variant is really wreaking havoc on the communities. Now, the difference between other communities and us is that we have the means of dealing with Delta variant, but people are just not taking advantage of it. So what's going to happen? It's going to run rampant in the unvaccinated areas. People are dying. The new cases of COVID are from what? Unvaccinated individuals. Yeah, there's a small amount of people that get reinfected with COVID, but it's not the same thing as having wild COVID if you're not vaccinated. Your chances of surviving being infected if you're vaccinated are much, much greater than surviving from the side effects of having COVID. And the big deal is that children that are unvaccinated, those under 12 that can't be vaccinated, are at high risk because we as adults that are taking care of these kids, we need to vaccinate ourselves to protect them, because what happens is the vaccines pass to the children may pass to other children, which which will take it to their homes and pass it to people, but they'll pass it back to their educators, and just kind of a vicious cycle. It goes on and on and on and on and on. So if we don't get vaccinated, we are directly contributing to the resurgence out there. And, whether you get vaccinated or not is not my decision for you. That's a decision you have to have with your primary care provider. But really consider the selfishness of what you're doing by not being vaccinated. Or if at least you're not going to get vaccinated, please do some mitigation. I mean, it's really sad that we're seeing parents bringing lawsuits against the schools, districts, and the people in their communities because they're trying to mandate masking. They're saying such foolishness that the masks are giving children increased evidence of bacterial infections. Show me the science behind that one. And the other thing they're saying, it makes children not be able to communicate and learn. Show me the science behind that one, and I'll believe it. I mean, some parents are in say, let's take Texas, for example. It's one of those areas where Delta is kind of raising its ugly head now. Parents in political it turns into political arena. The governor of Texas will not mandate vaccination, so Delta is surging in its community. We'll wait and see what happens with that community with that crazy thing. So, I think we're going to hear tonight from some of my other brothers about the mandate of vaccination by employees. I don't know all the ins and outs, but hopefully, Brother Dr. Guyton and Brother Gardner will talk more about this. But I know the Veterans Administration, if you are a medical provider in the Veterans Administration system and you want to work for them, you have to be vaccinated. You have to be vaccinated if you're going to take care of our veterans. Now, veterans are a very vulnerable population for contracting COVID-19. So let's talk about return to school in the fall. What's the big deal? Let's think about it. Since last year, how many children have died of COVID-19? Over 500 children have died of COVID-19 infection. And usually we talk about how many children die from influenza in a given period. Well, last year, influenza was very low. So we expected these numbers, maybe 200 or low to be from influenza. But we had COVID-19 out here killing our children. And now we're opening things back up. So what's going to happen? We're going to have COVID-19. We're going to have influenza. So what's going to be an impact on pediatric deaths from these two things rearing their heads together? So, the American Academy of Pediatrics has certainly endorsed that we should be, everyone over 2 in the school system should be wearing a mask. We're talking about the teachers. We're talking about the any personnel that works in the school system. Every student, whether you're vaccinated or not, going back to school in the fall should be vaccinated. Why? Because we're trying to protect that population under the age of 12 that we don't have the vaccines released for yet. They're coming, but they're not there yet. So these are the children that may be a reservoir for perpetuating the vaccine. And certainly with Delta out there, I'm really worried about them taking it back to the elderly population that may not have been vaccinated or have been vaccinated, but don't have the immune system continue to have a great strength against that. So, that's the things we need to think about. We really need to think about that going forward. But the biggest thing is this vaccine misinformation that's going to really hinder us getting a hold of this Delta variant. And what's going to happen? We're going to be seeing things like we saw last year. But I hope to God we don't go back to shutting down things as we did before. But it's all up to people out there to take the responsibility, to do the right thing, and stop making a political issue out of this so we can get the proper mitigation done. If you don't want to get vaccinated, that's okay. But at least practice some mitigation to decrease the spread of the virus as it goes on. And with that, Brother D, I yield back my time.
Well, Dr. Boykin, as always, you just bring it down for us, man. We appreciate you, man. Over 500 children. Wow. And so when you say children, are those children that were of the age, or were they 12? Were they able to get vaccinated, or do we have those details?
Well, a lot of them weren't children able to be vaccinated. I mean, we have 9-year-olds. Matter of fact, we have children under the age of 12 with long-term COVID. We haven't talked much about that on these seminars, but these are children that have had the vaccine, have long-term effects from it. We have a center in Cleveland, Ohio, Rainbow Babies and Children, taking care of these children with long-haul COVID. So people think that children can't get COVID. Is a big myth. They can get COVID. And wow. It's a variety of age groups that have gotten COVID, but a lot of the young kids. We know between the ages of 8 and maybe 12, they're very vulnerable. And we have a lot of deaths in that age group. So yes, we have a lot of kids out there that are not able to be vaccinated, that are still going to be at risk for getting COVID-19 and probably at risk for death. Although the numbers are very small and the severity of disease is very small, but there's one child dying for COVID is too many.
Agreed. Let's hear from our pharmacist that's on the line, Dr. Guyton. Good evening to you, my good brother.
Hey, good evening, brothers, and everyone on the call and this Skype tonight. It is my pleasure to be here again. We've been going through this marathon of a pandemic for almost 2 years now, and one thing that we're finding that may hinder or unravel all the work we've done in testing vaccinations is this misinformation. Now, we want to talk misinformation and we want to break it down. Um, what we found in studies is that even a small exposure to misinformation can deter a person from being vaccinated. Now, we did go through a great early stage of early adopters, as we call them, and having over 300 million people get vaccinated. But what we have to deal with now is this great issue of disinformation versus misinformation. Disinformation is spread intentionally. It serves as malicious purpose. It is truly politically driven or financially driven. So when we look at information being passed on these potential websites and social media platforms, we have to be able to distinguish, and we're working really hard within the communities, as well as you have a lot of our leaders continue to put out guidance on some of our governmental websites, the CDC, and some of our HHS.gov websites are putting out great information. Misinformation is something that we all can be guilty of. It is often framed in a sensational way. People feel a sense of urgency and they want to share something that they saw, and it's mostly in charge, mostly because it wants to get at your sensibility of anxiety about the vaccines. Now, we do want to understand that we have a history when it comes to vaccinations and research. We dealt with that early on. We know now that over 300 million people have taken the vaccines. We have enough data to understand the side effect profile and what this drug can do. So when we look at how this information and disinformation and misinformation is being purveyed across this country, we got to think about our technology platforms. We got to think about our podcasts. We got to think about our community news stations, our CNNs, our our MSNBCs. So when you take a look at technology platforms, the biggest purveyor of the misinformation has been the use. It may not be the technology platform, it's the use of that technology platform and the content that's on it. People are really apt to share information. They want it to go viral. They may even think it's helpful. But until you know it can validate it, don't share it. Do not share it. Now, one of the biggest things that this generation that we have that's working against us and for us is social media platforms. They connect and form millions of people at the touch of a finger on a button. The engagement is wonderful, but the accuracy of the engagement, the accuracy of the information, we're allowing a lot of emotionally charged information to be spread out and sensationalized, and it causes anxiety in our communities that have already had anxiety initially. So they weren't a part of the early adopter group. They were those that were thinking and waiting to see what happens. And as you see now with the Delta variant, those that we prayed for, that listened to us and were early adopters, are now dying. Here in Maryland, just last month, 130 people died. 99% of those people were unvaccinated. So this is a vaccine preventable disease. But when we continue to look at and work with the platforms and get our news from specific news stations and platforms, you got to understand those platforms are driven by what? Likes. They're driven by popularity. They're driven by algorithms that look at similarity, not accuracy of the data. So one study found that news stories that were false were 70% more likely to be shared on social media than true stories. Think about that. 70% more likely than true stories. So if you can't validate it, don't share it. We all are sometimes guilty of giving misinformation. Well, the problem comes in our community is when we start getting disinformation. They found that up to, I think it was 11 specific entities were spreading the majority of the disinformation that is hindering all the work we've done over the last 18 to 24 months to save this country from this virus that is now preventable because of all the great work by many of you all in the community, getting our people tested, getting our communities vaccinated. to come home and sit in front of a computer or in your iPod or your telephone, and that deter your best friend because they see a website that shared a baby dying because of a vaccine. I had a call a couple of weeks ago. Cedric, I saw a baby died of a vaccine, and they died within weeks. That was a lie. And I had to take this person I've known 30 years and say, hey, stop. You know, you gotta go to the accurate websites. You got CDC, you got NIH, you know, you got the HHS.gov, you got the surgeonjournal.gov. You got plenty of websites that can give you the accurate information. So make sure. So what can we do? What can we do as communities, in our communities? As I look at our fraternity, we look at our what we call districts: Florida, Georgia, Texas, Missouri. There are hotspots. There are where we need to be in the communities dispelling this misinformation. How do we do that? We work with our community leaders. We start looking at and talking to and providing information to our community about trusted entities that can provide us with accurate information. We do our research before we share information. You know, I'm guilty of sharing a great story quickly, but then I think about it, was that true? So I always go back and I verify. And some of the things that are happening now, media organizations, they're verifying information before they share it. Some of our social outlets, social media platforms are now looking at their algorithms and double checking and ensuring the algorithms are not purveying false information because of a like or a similarity. We must, as a community, discuss how do we share and understand the information about the vaccines, because the vaccine hesitancy is doing more damage to us at this point than we ever thought that not getting tested could ever do. And we're going to have to look at how that's going to impact your jobs, how that's going to impact your freedoms, because we're going back to mask mandates at some point. You got to look at the fact that even your government employees are going to be required to be vaccinated at this point. They're also looking at ensuring that, you know, we've already started with the VA. The VA employees, the providers, frontline providers have to be vaccinated. You know, think and follow the trend. If it's becoming mandated in certain areas, and you got to think about this. Our medical insurance providers are watching people turn away from a vaccine preventable disease and a vaccine that's causing them millions of dollars. What do you think our medical insurance providers are going to do? Right. They're considering mandating, if you're on medical insurance, you must have a vaccine. So we have to get in our communities so we can understand and help our communities learn and identify how to avoid sharing information that's inaccurate. We want to help address misinformation by having trusted entities, working with your health educators, working with your providers, working with your governmental agencies. We all want to be a part of the solution, but we want to make sure the solution is using accurate information. I have learned to engage with my friends and family that call me. When I get questions, the last week I've had 3 brothers call me and say to me, what should I do? Get vaccinated. You coach baseball. You're a police officer. You have a child that's in high school. You have 4 kids. You're the only provider of that family. You have an elderly mother. Get vaccinated. So if you don't do it for yourself, do it for them. And again, we don't advocate one way or the other. We're telling you, if you want to survive, get vaccinated. If you want your family to be safe, get vaccinated. You have a 95% chance of not being hospitalized. Now, there are some instances where patients that have been vaccinated are getting the COVID. I've had 2 family members who've had it. Within 3 days, they were recovered. They had an allergy, they had no smell, boom, it was over. And then you have those who have had it a year ago that weren't vaccinated, that are now dealing with long haul impacts and effects. They're in hospitals dying along with the new Delta variants. So this beast of a virus does not go away. It continues to grow. And the one thing we can stop is the misinformation. I beseech you, get out of your communities. Get over this hump of not believing that the vaccine doesn't work. We now can say this is a vaccine preventable virus. We couldn't say that 18 months ago. While we are trying to inform others and we don't realize the information is false. That is going to be something we really have got to think about. If you're not sure, don't share. I give back my time, brother.
Well, as always, thank you so much, Dr. Guyton. Let me just ask this before we bring our last horseman in to join us. Let me just ask you guys this: based upon all this information that all of you have shared, and again, I love the way we do this. We remind people that we are here just to provide the information. One thing that I know I hear from people is that they're still waiting, or how come none of the drugs, none of the vaccinations, they've been approved yet. What message do you have briefly for those that are still waiting or still saying, how come it's not approved, FDA approved yet, or I still want to wait it out and see what happens? What message would you have, Dr. Boykin? Let's start with you. Just make sure you come off mute so we can hear you. Go ahead.
Well, I say to you, first of all, people have to realize the way these vaccines were released was called emergency use authorization. We had to do that because we were in a pandemic. Normally, vaccines take a long time to be vetted and released. And so that's why they have not been quote unquote approved yet. But as Dr. Guyton said, in the short 18 months that we've had these vaccines at our disposal, they work. So it's only a matter of time before they are approved now. As a matter of fact, we do know that Pfizer and Moderna have applied for full vaccination, full approval of their vaccines, which is probably going to happen very soon. But I say to you, if you're going to wait, how long are you going to wait? How long you think, as Dr. Phillips always says, how long you think you're going to dodge that bullet before you get COVID? It's not a matter of if, it's a matter of when you're going to get COVID with all of the pockets of unvaccinated people out there. So stop waiting, because you're going to wait too long and you can be pushing up daisies.
Dr. Phillips.
Well, I'm going to just tell a story. Last night I was over at a friend's who unfortunately lost his wife last week to COVID. And the backstory was he wasn't vaccinated. He caught it, or it came into their house. And then she got COVID because she wasn't vaccinated. And then they both were hospitalized. He got better. She got worse when, they sent the word out that they had a prone, which is laying on your stomach while you're ventilating, being on the ventilator. That's definitely not a sign of good things. And she eventually died. So my wife and I went over to, express our condolences and support him. And as I'm walking out, he pulls me to the side and is like, yo, you know what? You told me 3 months ago that I should have got my shot, and I didn't follow up with it. And if I would have listened to you, I would not be sitting here in this position right now. That's all I'm going to say.
Wow. Brothers, family, and guests, we call these brothers the Four Horsemen, and you see before you three of them. And certainly this brother here, although he's not a doctor, he certainly by far is what we would call the heartbeat among this distinguished group. So with that, I believe he has some critical updates for us from the federal government side. Brother Wonzie Gardner, good evening to you, my brother. It's always good to see you. Just make sure you come off mute so we can hear all the wonderful news and information you're going to share with us. Brother Gardner, take us away.
Hey, first of all, brothers, I'm glad to be here, and I got to put a disclaimer out here. I'm leaning on the shield here, and I'm hoping and praying that what I say here is not attributed to me back in name form only, because I've been blessed to be in the room with these comments, and I'm going to go down because there's so many things I want to cover. FDA approval. It should be here no later than third week in August. The issue we're working on right now is patents versus community use. How long is the patents going to be out there? And there's a lot of things that the doctors can talk about this, but it's in the kitty. They have got what they call fast track. And so right now the administration thinks it's going to be by the third week in August at the latest. Please do not put my name with that because they know where it's going to come from. The next thing I want to tell you guys is this. We decided a while back that we would stop these meetings so we would keep the energy that we have when we're talking about this. And now is we're at a similar moment. My brothers have talked about to you about the medical side of this. Now, what I want to do is talk to you about the sociological side and what we're doing and how we're going to do this. I think Brother Guyton talked about this, and we want to have a discussion about this. I just got off a call less than an hour and a half ago. The mask mandate will be out, and it's already out there. But here's the issue we're having to do right now is, right now they're looking at hot spots. But in an entity and an organization as big as federal government, what we are advocating for is, let's man up, let's be all in, and say that for 120 days that we're saying if you go to any federal facility, whether you're a contractor, federal worker, or an individual coming and getting services for a facing organization, that you will have a mask on and you will have social distancing. That's number one. So they're working. There's a Safer Federal Workforce Task Force. There's a COVID Task Force, and then there's a Federal Implementation Task Force. And I've had the pleasure of being all three of those. And then there's a smaller group of people working with OMB and OPM that we're trying to figure out how we can do this, because we've recognized and realized that so goes the federal government, and so goes everyone else. And so you all will be seeing in the CNN news or whatever where we're doing this tomorrow. They said the president's going to talk. It's really going to be about probably Friday. He's going to come out and say he's going to mandate for all federal workers to have to be vaccinated. The Justice Department has come on board and said, even under EUSA, emergency use authorization, that the federal government and private industries have the right to do that. But what they were trying to wait on was they were trying to wait on for full accreditation by the FDA, and they can't wait that long. What we're trying to do is make sure that we have a blanket wide, not by region, but a blanket wide federal policy that says that if you come into those facilities, you will be vaccinated. And the reason we're doing that is the federal government is the largest employer in the United States, and a lot of cities, a lot of counties, a lot of states have been in front, but we're trying to get in front of that. The reason why they're hesitant about that is they're talking about the enforcement. What are you going to do for those employees that do not and will not get vaccinated? Do they lose their jobs? What kind of penalties do you have on those type of individuals for vaccinations? The other things we need to know, just to give you guys some behind the scenes, when we talk about the VA, there are Title 38 employees. And when we say title, there are certain laws and regulations that we have to follow for those type of employees. And the VA has the jurisdiction to do that. What's caused a lot of concern is that right now the president is talking about federal employees, but he's excluded the military. So I was talking to Veronica Hinton, who was a Chico of the DOD, and they've got a plan right now where they're going to try to say, no, we can't. Why are we going to have federal DOD employees, civilians, required to get vaccinations, not the military? So they're working that right now. So expect within the next probably 2 to 3 days, no more than a week, that all people wearing a uniform will be required to get a vaccination. And why is this important? Because when I was wearing a uniform, I was an anthrax baby. I don't know if you all remember this, but when anthrax came out, we had no choice. And I was in Korea. I took a shot every 6 months, right? It was one of those things you have to do. I mean, tell a military guy to shut up in color and get vaccinated. Because right now, it's less than 50% of DOD military people that are vaccinated. The concern we have right now is, from a federal perspective, we've got to be all in. And what we need is leadership. And from a political standpoint, as my brothers have talked about, there have been those that have been contrary to do this. And so what the Safer Federal Task Force do, and all the political entities on the right, excuse me, the left have been trying to do is getting the president to understand that this is a seminal moment where leadership is absolutely necessary. And what do we mean by leadership? We need someone to stand up and say, this is a pandemic that can be defeated by a vaccination. Brother Guyton said that 95%, I heard today was 99.2% of all deaths that have been caused since June have been in the unvaccinated. To put it simply, the unvaccinated are making this hard on everybody. So how do we get to that point? They're trying to use all levers of government they can use right now to say that you must be vaccinated. I must give our Republican colleagues some credit at this point. They've kind of come around, but it's far too late. We've got Americans dying. So in the next few days, you'll see some more literature coming out from the federal government saying that you will do X, Y, and Z. So I'm not sure if you all recognize this, but most federal employees are not back in their job sites. There's some in DOD, some of the nuclear regulatory agencies, and some of those that are what I call those frontline people that are required to go back to work. But most federal employees have not been going back to work yet. We have what we call the reentry and post reentry phase we were doing. And most of us were looking at September to October when we're going to start back. There is a move afoot right now to take a 120-day pause X and say that we're going to pause this thing by going back to work and saying we have a national pandemic and saying we're going to keep everybody home, continue doing what we're doing right now, and say we've got to kill this virus. Brother Guyton mentioned about the fact about unvaccinated and things, strategy we've got to do. But until the federal government, until we come together as a nation and recognize the fact that this is a scourge upon our land, and we will not defeat this in pockets. We will not defeat this as Republicans. We will not defeat this as Democrats. We will not defeat this as independents, but we will defeat this as Americans. That's the messaging we've got to do. We've done a very bad job of messaging. I want you to know Senator Portman, Senator Graham, and Senator Rubio were in a meeting today recognizing, eating crow, that what they've done and what they've said has not been true. And what they're trying to do is try to figure out how we can do the messaging going forward to make those Republicans that have said this virus and not taking the vaccine is patriotic to shift that mindset. It took us 4 years to get to this point, guys. 4 years of a Trump administration, not trying to get into politics, but 4 years of not doing this. And so the message they're doing right now is to give President Trump his due credit, because it was under his watch that Operation Warp Speed started, right? It was under his watch that we got this vaccine started. It was under Joe Biden's watch that we got a lot of people inoculated, but not enough. And so there are meetings going on as we speak right now, trying to figure out how we can message this where this is a win-win for everybody. And so the message that we're sending out right now is that we are not out of the forest. If we don't do things soon, this winter and this fall will be a dark winter, as they're calling it, because more Americans are dying. I'm sorry I came on the call late, but the projections are right now. If we do nothing right now, by the second week in August, we will have over 1,000 deaths per day, I think it is. And so you can correct me if I'm wrong, or a week of Americans dying. And the science and the data shows and tells us right now that the people that are dying are the unvaccinated. So you wouldn't think it's a rocket science to understand that if I'm not vaccinated, I'm vulnerable. What we found out through listening sessions and what we found out through various communities, including our own, there are people that are very skeptical, not because of politics, but just skeptical. Not because of what happened to us in the past, but just skeptical, right? And so the messaging that we're trying to send out now is don't do this for yourself, but do it for others. Anecdotally, I had a brother-in-law in Georgia, not going to call his name, and he hadn't getting vaccinated. And I called Vidal and said, Vidal, look, you made a decision. I'm not worried about you. I call his name. I'm worried about my sister. I'm worried about your sister, your brother-in-law, and others. How are you going to feel if something happens to you and you die and they're here left to bury you? In my situation, it was great. He recognized his Wonzie, I'm getting the vaccine. He got it. He's on the second shot. Okay. As Cedric and Brother Guyton said, Brother Boykin, Brother Phillips talked about, this is one-on-one combat where you got to go at an individual level, at the granular level. Okay. We can talk all we want about this and why the science works and all that kind of stuff. But until we get into the hearts and mind of our people and tell them the importance of getting vaccinated and why it's important, how it's helped the family, how it helps us as a people, we're going to lose. What I found out today, it's more of us that are not vaccinated than others. It's more Black people not vaccinated than others. I'm going to say it once again, it's more Black people and brown people not vaccinated than others. So what must we do? And so these things are being rolled out by the federal government. These calls are important. But brothers, I implore you to tell your circles that they've got to get vaccinated. We've got to be that talented 10th that W.E.B. Du Bois talks about. Okay. There's no shame in this. The bottom line is Americans are dying. And one of my colleagues said today, until we're all in, This will not end. Again, until we're all in, this will not end. And so I think in the upcoming days, you will see the president probably on Friday mandating federal employees. And I've heard from various companies, because they were in the meeting today, they're just waiting because now they're looking for a leader to lead and make the call. And I think you will see a lot of other um, companies doing the same thing. My church is also waiting, like many other churches, to see this. And we were trying to reopen, but as I talked to my pastor the other day, is the virtual church is going to be the norm for a long time, right? The in-person church will be the church for those that got to go. But we've got to understand we're in a new environment, a new paradigm. And brothers, if we ever want to get back to any sense of normalcy, we have got to take this shot. This vaccine, whether it's Pfizer, whether it's Moderna, Johnson and Johnson, AstraZeneca, or what's next, is a key to us getting back to normalcy. Brother Boykin made a very good point. Our children under 12 are depending on us grown folks to man up, to woman up, and do the right thing for them. They can't. The things that keep me up at night is I got a grandson that's 9 years old in Maryland going to public school, depending on people around him to do the right thing so that he has a chance to survive. Again, those kids under 12 years old are expecting us to do the right thing so they can survive. I've never seen a time in American history where we didn't rally around the flag and say we've got to do this. Brother Guyton talked about the politics. We've got to get past that. One of my biggest challenges and honors is going to talk to groups that don't believe this. I talked to the Republican committee in Maryland just last night. It was heated. I was an outcast, but I do what I do. And I didn't back down. And I told them, if you love America like you say you love America, get the damn vaccine. If you love America like you say you do, talk to your people. If you love America like you say you do the right thing. If you lose the next damn election, so be it. This isn't about election. This isn't about politics. This is about people. And how dare you be afraid to tell the damn truth when truth needs to be spoken? Truth is power. And so people are trying. I think the brothers on the screen, we're exhausted, we're tired, we're frustrated. You got the answers to the test in front of your hand to pass the damn test. Take the vaccine. And so, brother Mfofo, I want you to know I think that the president is going to take a very strong stand. He's going to make mistakes, and you guys might see this statement on the news because I said it. You hear it came from me first. We reserve the right to get smarter as we go along, but they're concerned about the messaging, what he said on July 4th, and I went off. I said, guys, stop. That was that point in time, but things evolve and change, and we reserve the right to become smarter as we go along with this virus. We learned the vaccine works. We learned it's effective. I think, and doctor, you all correct me, the vaccine, a good vaccine for flu is over like 55, 50, 60%. I heard earlier. This is over 90%. What's the damn problem? It wasn't discovered overnight. This is 15 plus years of pre-work done to get to this point. And so, not being a doctor, I can't go in that area. I'm tired. I'm frustrated, but we're trying to come, but we can't get there until all of us come together and do the right thing at the right time for the right reason. Thank you, brother Mfofo.
No, man. Thank you, Brother Gardner. And that might be a perfect segue. Let me put Dr. Guyton on the spot so he can come off mute and share with us as the pharmacist. So, out of all the wonderful things that Brother Gardner said, we all know this hesitancy. He identified us as a people that are hesitant about this vaccine. Why is that from your perspective? Why
So,
are specifically Black people scared to take this vaccine?
So let's look at the history of how we have been portrayed, with research. One of the major things that I've had brought to me is the fact that Tuskegee, but we got to remember, Tuskegee was not about a vaccine. Tuskegee was about a lack of treatment and a protocol that wasn't studied and put forth and okayed by a research committee. You're talking about a drug that has over 300 million patients. This is the biggest drug study ever. And we are here to tell you that the side effect profiles have been analyzed. Pfizer, Moderna, anything that's coming out right now, we can pretty much know what the side effect profile is. And we have seen the majority of the issues. What we have got to do is stop the misinformation and understand the hesitancy. On top of the hesitancy, one of the things that Wonzie brought up is we don't think it's going to impact us. We think that as long as I stay in my little group, I'm okay. We don't understand that we are not invincible anymore. We don't understand this virus doesn't care how strong you were as a running back in high school. It doesn't care that you don't get sick usually. It don't care that you are only at Big Mama's house and you don't go anywhere but on Sundays. So our community is one of a gregarious community. We are always going to be together. We're always together. We're always sharing information. We're always around each other. The hesitancy starts with that one person with the misinformation. Oh man, I ain't gonna do that. I got it. It is the lack of information, our past history of understanding what has happened to our community, and truly, some of it is going to be the ignorance of what is going on around them. A lot of us don't pay attention to anything that doesn't impact our pockets. And let's be sure right now, this has impacted more than our pockets. It's going to impact our livelihoods. So as a community, we need to, as chapters, get into our communities as we say we are, provide the service that our communities need now with being there to reinforce the need to get vaccinated. We got to get past the ignorance, got to get past the complacency, because we've gotten past the problem of capacity of getting vaccine. There's plenty of it out there.
Hmm.
And I'll stop there, brother Kofo.
That's powerful. Dr. Phillips, please.
Bruh, I mean, everybody's pretty much said it, man. I think, a couple other points, and I'm just talking about it from the standpoint of a healthcare worker. There's an issue of fatigue. Again, how do you find the space within you to be compassionate to someone who didn't listen? It's hard. And, again, for the people that work in those spaces, the emergency rooms, the ICUs, that have been dealing with people throughout this pandemic, it's very hard on them when they have to deal predominantly with over 99% of the individuals that are coming in are unvaccinated. And, as Brother Guyton said, I get asked questions all the time. And I'm telling you, man, I was just having a conversation in the past 48 hours, and these were the same questions that people had when we started this back in February of 2020. And these are individuals that are college educated, executive level positions. But again, it speaks to the ease that this mis and disinformation is able to infect us. And unfortunately, we're seeing individuals that had a shot. You read the story about the young woman in Alabama that the doctor was treating her and they were about to intubate her. And she says, can I get the vaccine now to help me? It's too late. I think we have started to recognize, and it's been spoken on throughout this call, the world ain't going to stop no more just because you waiting to see. You need to figure out what you waiting to see, because your economy is going to be affected. We're talking about jobs. Your families are going to be infected. We've talked about these kids that are under 12, but what about the individuals that have medical conditions, autoimmune disease, or other medical conditions, or those that are over the age of 75 and 80, who it's already been seen that even though the vaccine is helpful, those are the individuals that are at risk. So again, how many of us are going to be willing to step up and confront that misinformation or disinformation? If you're getting to a point where you want to make a decision, find somebody that you trust and ask them some questions about why they got vaccinated. Because again, I think one of the bigger problems that we saw in the very beginning was the fact that I understand it was a pandemic, but we went big before we went small, meaning people were more pushed. I want you to go to Washington Nationals Park to get your vaccine, or go to Shea Stadium, or go to Madison Square Garden to get your shot instead of going to the doctor in your neighborhood. And I think when we took the local providers out of the mix, that made a lot of people have a lot of space for uncertainty, and the seeds with the people that are perpetuating the disinformation, so they saw it as an opportunity. I could get in here and put some bad information out here. And unfortunately, like I said, we don't do our due diligence, even though we have the academic backgrounds to research these things. If we see a highlight or a byline on social media, like, whoa, and then you press share and you don't even read it. And then sometimes, because again, look at how these stories are written. 7 members of the Yankee staff get COVID and they were fully vaccinated. It doesn't say whether they had mild disease. It doesn't say that they were hospitalized. So again, if they weren't hospitalized, that means that they need to look at what contacts that they're having. But more importantly, the vaccine is working. So again, we've got to be more educated, because unfortunately, the media seems more invested at times in an emotional response than making sure that we have understanding. And I think if we, as members of those communities, as people who care about those communities, as Brother Gardner said, that talented 10th, we got to bring it back to the 90%, and we got to bring it back to them properly, because unfortunately, and I can understand how difficult it was for that man to come to me last night and say, yo, I made a mistake, bro, and this mistake cost me. It gave me a whole nother level of respect for him, but it also gave me a whole nother level of ease because of the decision that I chose to make for myself, and that specific story won't be my story as we look at this thus far this year, 2021. The number of deaths that we've seen internationally has been more than the entirety of 2020. And what is the big denominator that we see there? They do not have vaccine. And that is why the COVID virus and these variants, because Lambda is on the skirt in the hills looking down, y'all. And the thing with Lambda variant that's concerning, if it comes here, is that it's been shown in the laboratory that it does not respond as strongly to the antibodies produced by the vaccine. So if you want to be out here still doing your own thing, waiting to see, what you are doing is giving Lambda an opportunity to multiply and potentially invalidate the vaccine that all of y'all are benefiting off. Y'all need to go out and buy every vaccinated person a drink for making y'all safe. And you still not safe, even though they are, like in my county in New York, I live in Nassau County, we have an 80% vaccination rate in individuals, in the adults. So we've been fortunate, but you go south side of Brooklyn, south side of Queens, especially as it was said, in communities that look like us, you've got 35% in Brownsville. You've got other areas, Bedford-Stuyvesant, which is another area that resembles us, under 40% vaccination rate. And you see people celebrating or enjoying their freedoms, and they doing the most. I'd be interested, and this is just an academic question, what is the COVID rate in Milwaukee right now? And with that, I'll end my remarks. Thank you.
Brother Popo, but can I come on top of that? Two things I forgot to mention that you all need to be aware of. I think there are 17, maybe 18 states right now that have passed laws that have prohibited schools from allowing kids to have masks. The federal government is trying to enlist the full force of all the departments to look at different things. And I know that The DOJ is looking at that, and we're trying to figure out with Congress, supposedly, and that's why those 3 senators were there. What can we do to do that? Because that was done in a sense of haste. Because what we're saying is we're going to have 17 or 18 states of vulnerable kids with this pandemic spiking, who will have no type of protections where teachers or anyone in that school system can wear a mask, and that's a recipe for disaster. So at the granular level, that is where they're trying to work it also. The other point I want to make too is a lot of people on this call, others said, hey, I've done my part and I've been vaccinated, so I'm done. And I like to say, no, you're not. And you may not agree with me, but I said a comment that one of my colleagues, Tom Chalecki, mentioned earlier today. If we're going to beat this, we got to be all in. And why is that an important statement? Even though the 5 of us have been vaccinated, we have to model the behavior that we want to see done by others. And the behavior that we want to see done by others, because we got a group of Americans that have not done what they're supposed to do, is that we got to wear masks. Okay? It doesn't matter whether you're vaccinated or not. You got to wear a mask. And the reason we've got to wear a mask is that when we do that, we're signifying that this is bigger than me, and I'm part of a greater collective that I'm trying to get survive. I'll give you a good case in point. During this process in my trip to Jamaica, bro man put on about 10 to 15 pounds that I didn't want. So for the last 3 weeks, I've been going to Planet Fitness, doing what I do. And when I go to Planet Fitness, I got on a mask. Is it uncomfortable? Yes. Could I do better if I didn't have it on? Yes. I'm on a treadmill because we got this 5K thing to put the plug in for Brother G, right? In LGG, we're trying to do a 5K run. I have a mask on, okay? Young lady came to me and said, why do you have this mask on in here in Planet Fitness? And I told her why. And after a 30-minute conversation and watching her work out, she said, Mr. Wonzie, I'm going to go get a vaccine. That's that tactical one-on-one type of conversation we got to have with people, and we got to demonstrate. So my message to every bro on this call tonight is, whether you got a vaccine or not, and if you got a vaccine, put that mask on, be proud about that mask, and do the right thing for the right reason at the right time. This is not about you, it's about us. It's not about I, it's about we. And so we've got to step up, and sure, it's inconvenient. Sure, it's hot. You've done your part, but we're finding right now, just like we were pledging. Sometimes you got to take the extra mile and go the extra step for your wingman, your bro, your LB, whatever, to make sure you get the right thing. Well, all of us are our own LBs right now, right? And we got to do the right thing and mask up and man up and tell the story and not be afraid to talk to people and say why you got a mask on. As a matter of fact, you want to invite those conversations. And in the conversations as, where's your mask? Where's your vaccine? Because until we mask up, until we vaccine as a population, as Brother Guyton said, we're going to be spinning in the winds. And we've got to do that.
Thanks, Brother Gardner. Dr. Boykin, what I need you to do for us is, as we're coming to the end of our program, I need you to give us that message for those parents that are preparing to send their kids back to school, whether it's elementary school, whether it's middle school, even if it's college. But we want to focus on the kids right now that are going back to school. Share some wisdom with the parents as they prepare to send their kids back to school.
Okay, first of all, I'm going to say, please, please, please dispense with the play group mentality, the play date mentality. You know, some of the governor of Texas saying that he doesn't want to mandate masks because parents know whether or not their children should be wearing masks. No, they don't. And I don't mean the parents are ignorant and stupid. You don't know, because you're following the play group mentality. You know, you talk about what Susie does and what Johnny does and what her husband does and blah, 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 blah. But that is not the way to get accurate information. Okay. So part of the hesitancy in our own circles has been, access to care. You know, I realized Dr. Phillips said, and I think some other brothers said it, that, you know, people rather talk to their own primary care doctor before they get the vaccine. Well, now is your opportunity to do just that. Stop talking to the play date mom. Stop trying to be that circle, a socialite, or whatever. Take the time and talk to your doctor. You don't have to go in. It's a free phone call to pick up the phone call and talk to your doctor about the long-term effects. The governor's not going to know what the AAP data show. They can spout it out, but they haven't practiced as a pediatrician. I spent 22 years talking about people. And what was my success rate so high for? Because I listened to what they wanted to do. If they wanted to follow an alternative plan to get their kids vaccinated, I didn't fight them. I said, cool, you're getting your kids vaccinated. So please get the right information. Make that phone call to talk to your primary care pediatrician. Get your kids caught up on their current vaccines so that nobody's going to have any corollary diseases that'll be affected by getting COVID. Because what's going to happen? These kids are not vaccinated. The unvaccinated people that are not taking responsibility as adults and older children and adolescents to get vaccinated are going to affect those kids. And it's going to be a high rate of absenteeism, high rate of illness, and a high rate of infectivity. You're not going to get rid of those masks and other mitigating circumstances until you realize that you got to get the accurate information from your pediatrician. We have a wealth of information. We have a wealth of sites we can send you to get that information if you don't want to talk to your primary care. But you have the ability to talk to your primary care doctor, your primary care pediatrician now. We're all sitting, waiting, willing to talk to you about that. I hear so much crazy stuff about the long-term effects. Well, who knows the long-term effects of the flu vaccine? Who knows the long-term effects of life? No one can predict that. We're not giving a time saying, you know, well, on this day and time, your child's going to die. On this day and time, you're going to die. We don't know that. So we got to stop all of this foolishness about the long-term effects because we don't know. But the data has shown so far that these vaccines are safe, and we have a safety profile. We have safety programs that these vaccines are under high scrutiny for that are showing that in children alone are having much safer and less side effects than the adult people. So as your child gets ready to go back to school, please, if you're not vaccinated, get vaccinated because that's your child's ability to fight off disease if you're vaccinated. So with that, I'll end my time.
Well, with that, we are almost at the end of our program. Let's do 30 seconds, 30 to 45 seconds. Closing statement. Dr. Boykin, we'll start with you.
Okay. So please, do your part. If you're vaccinated, talk to other parents that are not vaccinated. Listen to their reasons why they won't get vaccinated. And at least encourage them to go get the accurate information. Stay off the social media. You know, I know all the kids think it's cool to, you know, send this out because it looks sensational to do that and the other. But look at what your kids are doing. I'm not saying take away their social media, but check out what they're looking at on social media. What are they spreading that you know as a parent is not true? Because you can control that. But most importantly, if you're an adult or if you're an older adolescent and you can be vaccinated, do it for the kids that can't be vaccinated, please, because they have us to depend on to not have to be victims of COVID-19 disease, whether it's mild or whether they die, because kids do die from COVID-19 disease. Thank you.
Thank you, Dr. Boykin. Dr. Phillips.
Well, what I would say is, again, what do we need to do to protect ourselves? You know, I would definitely say my recommendation is to get vaccinated. But if you are not vaccinated and you're not sure, you need to start having that conversation with either your doctor that you go see, a close friend or family member or community member that you know that has been vaccinated, just so you can get some real information, because things are starting to be impacted by you being at risk for making this pandemic worse. And if you are part of the at risk making the pandemic worse, some of the activities that you like to participate in could be interrupted or interfered with. As I said, in the city of New York, if you are a city employee and you're not vaccinated, you are going through a very aggressive testing protocol, which is going to have multiple tests that are going to be done regularly during the week. And again, you know, this is a very difficult thing for people to stand up and deal with. So again, you know, if you want to stay in front of that, protect yours, as it was stated earlier, then we got to make sure that we get the right information to make the best decisions for ourselves. And all of us need to be careful. If you are in a high-risk environment, whether you vaccinated or not, we need to make sure we wear a mask and do things to protect ourselves and those around us. So with that being said, I'm going to yield my time. Thank you very much.
Thank you so much, Dr. Phillips. Let's go to Brother Gardner.
Brother Amfofo, we live in a democracy where our individual freedom are sacred to all of us. But for this pandemic, our individual freedoms have been hijacked, and we've been led by whatever media, social media, whatever you want to call it, political persuasion, to look at this through the lens of partisan politics. There comes a seminal moment in a country and the life of a person where you've got to dig down deep and look inside of yourself and ask yourself that why question. Why do we exist? Why is our union, as imperfect as it is, why has it gone on for so long? And you will come to the conclusion that in times of strife and tragedy, we've always rallied, I'm not going to say around the flag, we rally around a purpose. And that purpose has always been to make a more perfect union, to make a more perfect place. We're sitting at a crossroads where this perfect union or imperfect union has been threatened by a lot of factors. And I'm not going to talk about those. The only factor I'm going to talk about is this virus. We have the capability to wipe it out through vaccines that were produced here in America that can save everybody. So my message is that for everyone on this call and others to think about where you are in your life and not think about I, but us. And not think about you, but we. And recognize that we're all in this together. And until we're all in, this won't end. Thank you.
Thank you, Brother Gardner. Let's go to Dr. Guyton.
Brother Pofo, and to the esteemed group here, and to everyone that can hear my voice. We have come through one of the most life-changing events in all of our lives. We are fatigued. We've been through multiple phases of this, from testing to vaccination to discovery. Now we have a vaccine that can save lives. And we still, as a country, have to understand that, as Brother Gardner says, we live on our civil liberties. We are stuck in, hey, I have the freedom to make a choice. The choice that you have right now is, what are you going to sacrifice for the survival of your kids? What would you sacrifice for the survival of your wife, your mother, your sister? So we're looking at the ultimate sacrifice. We're looking at putting all our lives on the line. We're looking at how our next generation is going to look back at us as we deny the fact of a life-saving vaccine that has been proven to be effective. We all are fatigued. We all are looking for answers. And some places are giving us disinformation. Some places are giving us answers that are really out there to hurt us for a political reason, financial reason. But it is a way to get around that. Find those trusted assets, those trusted informational assets. For me, in the last 2 weeks, I've had brothers call me from my past, from my chapter, and just ask me simply, say it, what should I do? I want to meet them where it motivates them. If it motivates that baseball coach because he coaches baseball to get the vaccine, bruh, get that vaccine. If it motivates a brother because he's about to go to Jamaica with his wife and he doesn't want to come back and hurt his kids, get that vaccine. If it motivates a mother who has been thinking about it for years, that should she get the vaccine and she got a high school student in the house, she has an elderly mother, I want to meet them where they are. But again, I ask you, what are you willing to sacrifice to survive and for our future generations to survive? I yield right there, Brother Puffo.
Thank you so much, Dr. Guyton. As always, to all of our horsemen, speakers, presenters, thank you so much. And again, as a reminder, I mentioned it at the beginning of the program and again at the end of the program. Yeah, the comments that you've heard, please be mindful. These comments belong to those brothers as individuals, does not reflect Omega Psi Phi Fraternity Incorporated or the organizations for which they may represent. I certainly want to take the time to just thank again all of our doctors and brothers that joined us tonight. Thank you for joining. Some of you have been with us since the very beginning, and we will continue to bring this information. Again, Kelvin and Pofo, second district representative of Omega Psi Phi Fraternity Incorporated. And last but certainly not least, I certainly want to share with everyone our partnership with the American Red Cross. I encourage you to donate blood. Certainly, our fraternity brother, Dr. Charles Drew, played a critical role with the blood banks. So I encourage all of you, please visit the website, goforthered.org, and make your contribution. But to us, African Americans, why is giving blood so important? Simply because there's not enough donors. African Americans, we make up 13% of the US population. However, less than 3% of us actually give blood. So I ask you, in addition to everything you've heard with the vaccine, please schedule your appointment to donate blood as well. As always, we thank our producers, Brother Piercy, Brother Worley, Brother Ed Hill in the background, making us be able to produce this information and share it with you all. As always, stay safe, stay well. My name is Brother Kelvin Pofo, the second district representative. Thank you and good night.